This is the Whole Care Network. Helping you tell your story one podcast at a time. The following Care Lab podcast does not provide health or medical advice. All content is provided for information purposes only. Listeners are encouraged to speak with their healthcare provider for specific healthcare advice and are wholly responsible for the outcome of implementing any tips or information presented.
Definitely
Hey,
leave that
everyone.
part in. And all that head nodding. Yes.
All this. Welcome to
Yes.
Care Lab.
Welcome to Care Lab, everybody. We're glad to be here today. We have a serious topic, I think, but you got something unserious to talk about first?
Yeah. I mean, I'm full of stupid stories, basically. So that's my primary role here on Care Lab is to bring the nonsense. No, I hope that's not. I hope that's not true. But I do have nonsense to bring. Okay, so so I was getting everything together to get out the door this morning, and I had this crazy number of beverages. I literally so I'm getting in the car to go, and I had to have my kids help me carry because I had 4 different types of drinks.
Why? All for you?
All for me. I mean, my kids had their water bottles too, but no, they're all for me.
Okay, so number one.
Well, if I have to interrupt this episode to go to the bathroom, you know why.
We will know why.
You'll know why. We'll edit that out. We'll edit up any of my bio breaks out. But okay, so number 1, I got my water.
Clutch. Gotta have that.
I always gotta have my water.
Yes.
Number 2, I got my tea. Have to have my tea. This gets me through it.
This is your substitute for coffee, right?
It
More
is
coffee, and now you're tea.
I was coffee, and now I'm tea. But today I was feeling a little bit sluggish, and sometimes I like to treat myself on Friday, so I actually have a little bit of coffee too.
In a nice, cute little cup.
I got myself I brought just a tiny little one, and I probably won't even drink all of it. It's just I still love it.
You just need a little hit.
It's just my little hit. And then I don't have the other container anymore because I finished it on the way, but I had a smoothie for breakfast.
So that was your breakfast. So in theory, that could have been a bowl of some food, but it's just that cup of smoothie.
It's hard to eat a bowl of food in the car. And I was short on time, hence smoothie, because you can sip and drive.
That is a lot of drinks. I'm going to say that's a lot. That's a lot.
Yeah. I mean, it occurred to me as I literally had the smoothie in my pocket as I was going out the door because I didn't have enough hands, and my kids didn't even have enough hands with all their stuff too to help. And so it occurred to me that it was a little ridiculous. How many beverages do you have right now?
Okay. So I do usually go out the door with more than one beverage, but it's not always for me. I decided to make my coffee at the office. One less thing to take. I always bring my water. And then sometimes you're right, eating out of a bowl in the car is hard, but I do eat at least one meal a day in the car. And sometimes it goes in a cup. So I had a cup of cereal today.
Do you love eating in the car? Because I actually love eating in the car.
I don't know that I love it, but it's very efficient. And people who know me know that I care a lot about efficiency. So I might even be up early enough to sit and eat at the table, but I don't because I'm like, I can do that while I drive. I can do something else while I'm in here. So that's horrible, but that's how it goes.
So I don't like to eat while I'm actually driving, but I do love to eat in the car. I love to sit and park and eat just by myself in the car. I don't know if that's sad or...
I don't think it's sad at all. That's like getting your own time. You got kids in there. You go away from your workplace. You do...
Yes.
Zach eats in the car in his lunch break all the time. And so he cherishes that. So I get it.
I think it started after I became a mom. I was like, oh my gosh, there's nothing like just sitting in silence with food in my car.
Yes.
And just eating.
It has not... I'm not going to say this is how many times this has happened, but definitely has happened that I have sat in the car in my garage in order to avoid everybody in my house.
That happens every night for me when I get home. I take a solid 3 to 5 minutes, and after I park the car in the garage, I just sit there. And eventually, if I'm there long enough, my husband will come out and be like, "Where are you okay?" And I'm like, I'm going through emails, or I'm sitting listening to radio show or something like that. But yeah, that's my, like, it's like, okay, change my game face. And now it's family time, and we're going to go do the other thing. We're going to do all the other things.
Totally. Those transitions are super important, I actually think.
Okay, so as you said at the top of the show, we actually do have, I think, some pretty serious topics.
Yes,
some pretty serious, not tapas, topics.
Although tapas would be great right now. But just
tapas would be great right now, especially after all of the liquid that I have consumed. But yeah, so there obviously, we have some huge changes that are happening right now and coming down the pipeline in the way that our government and our bureaucracy is structured and that is run. And I think no matter what side of the aisle that you're on, it's really important to be informed about what's happening so that we know how changes are going to affect us, might affect the people that we love, our parents, our children, our neighbors, because when it comes down to it, the things that are affected are the things that affect everyday Americans, right? It affects people. So
that's right.
We thought it's so important to have a good understanding of, more about what's going on, how changes might affect things. And also, if we don't know what we can do, if we don't know how potential changes might affect us. So Brandy, you and I both did a little bit of research, but studying up particularly into some of the cuts that are coming to the Federal Health and Human Services Department, because this is Care Lab and we care about health and
Absolutely.
We care about caregivers and people. And so we thought, well, if there's something we're going to look into, we should probably get some more information about this. So we did.
We did. And this is initiated by every department has been having cuts, right? And so of course at some point it was going to end up at healthcare, because healthcare is one of our biggest spends in the country. And so I was shocked that we cut 20,000, well, first 10,000, and then like the next day 10 more thousand employees from Health and Human Services, which is an astronomical amount in my opinion, but still a fraction of the number of employees that work for this very massive organization. And so I was like, well, if you cut 20,000 people, what is that impacting? It's not like 20,000 people were working and doing nothing. So like, what is that impacting? So that led us down this path of understanding that more deeply. And I learned a ton of stuff about how HHS works. For example, it has like 28 different organizations within it, agencies within it that impact our everyday lives, like all of us. And so I was like, well, that's a lot of agencies. And so what's going to happen with that? And understandably, they want to feel like there's like duplication of services happening there. And because there's 28 different agencies. So I could see that maybe. But then when I started looking about like who's getting impacted, they are actually wrapping up or closing certain whole agencies, like the Administration for Community Living, which maybe sounds like nothing, but it's actually the vehicle that makes sure people get Meals on Wheels, among many other things. But like that comes like right down to it.
I had no idea that Meals on Wheels was a program that was administered like through an agency at Health and Human Services. I didn't know that before. And that's a really impactful program. I mean, people rely on that for their nutrition as a community. Like we rely on that to make sure that our older adults who can't go get that food for themselves are getting fed every day. Like that's a big deal.
Not only getting fed, but the program's intention, or even the way it started, was to make sure that somebody had eyes on those older adults who can't get out, right? And so Meals on Wheels started by like having a volunteer come every day and drop off the meal every day as an excuse to be like, peep in and say, hey, how's it going? And have some part of connection. And, as the program has grown, not every site is able to do everyday visits, but they're doing weekly visits at the least, and dropping off meals for the week. And so to have a whole, and that's not the only thing that the Administration for Community Living does, but that's one of the ones that I feel like almost everybody knows somebody who has Meals on Wheels. And the government says that they're not going to eliminate anybody's services. However, they are eliminating the organization that funds that service. So while it's not coming from the top down to operate a Meals on Wheels, like your individual organizations in your community operate them, ACL funnels the money make sure that they're tracking the stats and increases the budget as they need to for getting that stuff out for that and for other things. So that's very scary, actually.
Yeah, I think so. I think that's a great specific example to start with. Let's pull it back to a little bit of a broader view. I think to give a little bit bigger overview, and obviously, like, we're not going to go into all the agencies because we don't have time in a single episode to do that. And of course, you and I aren't, like, we're not sitting here claiming to be ultimate experts about these things. We're just like two people who are regular American citizens who like want to know what's going on and understand how these things are working, right?
Absolutely.
But let's pull that back a little bit because, okay, so what you said, so there were 10,000 jobs eliminated. There's another 10,000 jobs that are about to be eliminated as well. So that's 24% of the entire workforce of Health and Human Services, which is pretty crazy. Let's talk about like just an overview. So what are some of the other agencies that Health and Human Services oversees besides the like Administration for Community Living, like you said? Hey there, it's Emilia. Listen, I am so thrilled to have a great resource like Ask Sammy as part of the Care Lab team, and here's why. It's a game changer for aging in place because it makes it so simple. All you do is ask. Just type in your question or even tell Sammy what the problem is and get tailored solutions. Everything from innovative adaptive equipment to comprehensive resources. It's a great way to become more empowered, to live more independently, and to live with greater confidence. And my favorite thing about how Ask Sammy works is it's deeply rooted in dignity and practicality. So whether you're a fellow therapist, a care partner, or someone who's seeking solutions for themselves, visit www.asksammy.com. We're going to link it in the show notes so you can find it there. Start making home more accessible today. Now, back to the show.
Sure. There's the centers, the CDC. There's the NIH, the National Institutes of Health. Sorry, CDC is Centers for Disease Control and Prevention. And we should all be familiar with them since COVID. And NIH is the National Institute of Health. It focuses on it funds the research that's necessary in order to get new medications and stuff like that. The FDA is in HHS. Centers for Medicare and Medicaid, CMS. So everybody's on Medicare and everybody's on Medicaid is in that agency, which is also under HHS. So there are a ton of organizations. Also, I forget its actual name, but there's a whole mental health agency that's also getting cut when we already know we don't have very many mental health services in our communities. So that agency is getting cut. So there are a ton. Those are some of the bigger ones that you might have heard of.
Yeah, I think when I kind of first heard about the cuts that were happening, my initial thought was like, wait, isn't Medicare and Medicaid overseen by HHS? And then obviously doing the research that they are, and then finding out that it's actually about 5% of the staff at CMS that's going to be cut through these role reductions. And I guess like my question would just be like, what are the jobs that those folks were doing, you know, and how is that going to affect the healthcare services that so many Americans. So I want to say, hold on, I did the research on this. So 37.8% of Americans, of the US population, is covered by either Medicare or Medicaid. And it's actually split. I was surprised to see it's
That's
split.
surprising. That is like
right
exactly down the middle.
Exactly down the middle. Crazy, right? So, and this is from the US Census Bureau. So 18.9% of Americans use Medicare and 18.9% of Americans use Medicaid, including the CHIP program, which is the Children's Health Insurance Program, which makes sure that kids who maybe their families make too much money to be on Medicaid, but they can't afford other insurance and they're not insured another way, that those kids have access to health insurance. Sometimes in some states also covers pregnant women. So, but anyway, this is a huge percent of the population that is covered by these services. And it's not just like CMS, that's the, you know, Centers for Medicare and Medicaid Services. It's not like CMS just like cuts the checks or just
they're an
talks to people
operating
about
agency.
benefits. They're an operating agency. They're doing everything. They're overseeing. They're saying what is covered and what's not. They oversee the payments that go out. They oversee quality control. They oversee fraud. And compliance. I mean, they're the people. If you have a question about your Medicare, these are the people that you call to ask that question. If you're having trouble getting a benefit paid or with a provider, that's the place you go to report that complaint and where you have any recourse. So,
and that's the place that's also judging, like you can use CMS Compare to see like, how does this nursing home stack up? How does this rehab hospital stack up? So you can decide which one's a good one to send your person to.
Mm-hmm. And so it stands to read like that is such a massive, massive job that this agency is trying to complete. It stands to reason that they need some folks to do that and to do it well, and that it's really important. And that's not to say like, here's the deal. I think that we can all agree that there are always opportunities to streamline things and be more efficient. And certainly that's true in the government. I don't think anyone would ever argue against that, but we should know how things are actually going to be affected when we have like massive changes.
Yeah. And I think it's also important that like sometimes I feel like government agencies feel ethereal. They're like up here, they're not really connected to what we do down here. And because you don't maybe necessarily, you might not have ever called CMS, as healthcare professionals, as business owner, I definitely have and have engaged directly. But if you're on Medicare or Medicaid, you just make sure that you have your cards, you go to the place, it works, you get your healthcare. But that's because the system works, right? And so if the system doesn't have what it needs to work, your experience is going to be significantly different, right? And like, I think the sad part, this is good and bad. So the good part is that a lot of our systems that the government manages work pretty well. And so they work so well that you don't think about it. You expect it, right? And so you don't have an experience in this generation of not having that thing. And so you don't have anything to compare it to. Even though everything has its problems, there's inefficiencies everywhere. Is fraud happening? Sure, because it happens everywhere. That's why we have the agencies in order to catch it, right? Because we're dealing with people and people be messing up. But
I want a t-shirt that says, I want a t-shirt with that on. People be messing up.
People be messing up, bro. I mean, that's what it is.
Quote, people be messing up. Dr. Brandy Archie.
Dr. Brandy. I want that shirt too, actually. If I wear it, I'm like, aren't you Dr. Brandy? I'm like, yes, I am.
Yes, I am.
It's like, so when it works well, you expect it and you don't think anything about it. So when somebody takes it away or changes it significantly, it doesn't feel like a problem because you haven't recognized the problem. And then it'll just be later, once that thing has enough holes in it that doesn't work well, that then you're going to be like, yo, this is a problem. And that stemmed from all the changes that happened before, right? And so even if you don't see any difference, which I hope you don't, in your healthcare today, tomorrow, or next week, if you cut 20,000 people without much thought in who it is and what they're doing, and there's not like already a pre-formed plan about how we're going to absorb all this, you're going to see impacts in the next few months.
Yeah. I mean, there's just no way that you can make major change without having some collateral damage. That's just not how it works, right? Like if you're gonna make any major change in any part of even your life as an individual,
yes,
some things might be good. Some things are going to be bad. Like but there will be consequences both ways, one way or another. And so understanding the potential for those consequences and what they might be, how they might affect us is a really, really important thing that we need to do. And, to ask questions about, to advocate, to make sure that the things that we really need are being protected, right?
Yeah, for sure. And then I guess somebody would say like, okay, well, if there's 20,000 people that are getting left out of the equation now, then they probably had too many people to begin with. Somebody might argue that. I would also say though that because it's such a massive system, when you're thinking about Health and Human Services HHS, and it has so many impacts. Sometimes the only way that you connect with people is about like how it is economically, right? Like sometimes we see, I guess like If you think about how much money you spend on utilities in the place that you live, when you pay that bill, it might feel like, this is so much money. But if you just didn't have that thing, you'd be like struggling significantly. So when we look at the balance sheet and see that, like, okay, we're spending so much money on payroll to run these agencies, can't we just cut some of this? You also need to look at the other side, like, what's the benefit? So, like, for example, let's go back to my Meals on Wheels example.
Yeah.
They've studied this, and the return on investment for funding Meals on Wheels is that for every dollar that the government has spent, that we have spent as taxpayers on Meals on Wheels, has returned $2 to $3 in healthcare savings, because that person, it has the right nutrition, somebody checks on them, finds them before they're dead on the floor, gets them the help that they need, whatever. All those scenarios that occur just because of the Meals on Wheels program has a $2 to $3 healthcare savings for every dollar. So that's a profitable business, even though it's a nonprofit passing out money. You know what I'm saying? That's profitable to our economy. And so we're preventing hospitalizations, we're improving health outcomes. There's benefit to this. And if you haven't seen the physical benefit, because you don't have a person on Meals on Wheels, we can at least recognize it from a dollar's perspective, right?
Yeah, absolutely. And I think I like how you're bringing up this point that, like, and I think we've all had this experience in our own lives. Sometimes you make an investment in order to get a return on that investment, right? Sometimes in order to make more dollars or get more benefit of something, you have to put something into it in the first place. You can't just say, if you want to grow in your wealth, if you want to grow in your health, then you have to make an investment in that. You can't just say, like, well, this is too much upfront, I don't want to spend it at all, because then you're not making that investment. There's nothing to grow from there, right? And if you say with people's health, we're not going to invest in that, we're not going to do the things that we need to keep people healthy, there is going to be a huge bill. Even though you might be saving that $1 to begin with, there's going to be a huge bill coming at you in the end, when at some point you got to pay the piper.
Absolutely.
So this is interesting. I was just like, during the course of our conversation, I was thinking, okay, so there were about 80,000 people working for all of the departments at Health and Human Services. Now there's going to be right around 60,000 people. So like we said, it's about it's right around a 24% cut in jobs. And I was wondering, like, okay, so 80,000 people does sound like a lot of people, and it is a lot of people. I was like, how many people work at Amazon? Right? So Amazon
Did you look that up?
I did. So Amazon employs 1.556 million full-time and part-time employees.
That many people?
That many people. And of course, now Amazon is a massive company. They're doing business all over the place. But their primary thing that they do is get people goods.
Yes.
Right? Is get deliver packages. They get the stuff, they deliver it. So they're a huge company, but they have more or less this a pretty tight mandate, all things considered. If you
as far as like the work that they're doing.
In terms of the work, exactly. In terms of the work that they're doing, like there's like they have a clear scope of the services that they provide. Health and Human Services has all of these agencies that, to your point, they run Medicare and Medicaid, which insures almost half of the U.S. population. So they handle the healthcare for almost half of the U.S. population. That's one agency. They handle all of the research. They do the FDA, which is Food and Drug Administration, which does all of the drug approvals, monitors the health and safety of what you and I are eating, what we're feeding our kids, all of these things. They have this huge scope of services that they have to provide, that they have been providing, to your point, mostly not perfectly. That's not to say that anything, that there aren't improvements that could be made. And I think we all have complaints like, oh, I wish FDA did this, or I wish Medicare did that. Or we've talked about on this program, the things that we wish that Medicare would do differently, right? But if you think about the number of things that this agency is responsible for, that this department is responsible for, and the number of Americans that it impacts on a daily basis, this work, which is every single one of us, because we all eat, because we all need healthcare, because we all love someone who also needs those things, because we all need medicine. That's actually crazy that it was only 80,000 people. If you think about it, like Amazon has over 1.5 million to deliver packages.
Care Lab listener, I have a question for you. If someone you love was going to hire a caregiver, what qualities would you want that caregiver to have? You probably want them to be reliable, trustworthy, kind maybe, just a generally dependable good person, right? Second question, would you also want them to be trained? I'm going to guess the answer is an emphatic yes. Okay, third and final question for you. Do you think it matters who provides that training? Like, is it cool if it's just anybody? Or would you want that person providing the training to be a qualified expert? Assuming you do, in fact, love this person that needs a caregiver, you probably want the expert, right? Well, that's what Higher Standards Caregiver Training does. Higher Standards Caregiver Training provides 100% occupational therapist-led training for caregivers. Caregivers get taught everything from gold standard foundational skills for transfers and activities of daily living, all the way up to how to deal with specific diseases, injuries, and illnesses. And most importantly, they are taught these things in a practical way that enhances the participation of the person being cared for, and it protects the safety of everybody involved. Why? Because everybody deserves a higher standard. Find a course for individuals or learn about training for care organizations at higherstandardscaregivertraining.com. Exactly. That's a good way to put it in perspective. That's why it's important to put investments of any kind into perspective, right? Because you're putting in something, even if it's not money, you're putting in time and working out or running or whatever. That might not cost you anything dollars wise, but you just got to put in the time, right? You're putting in something to get something in return. And if you don't connect those two things, it can feel like the investment up front is not worth it if you don't actually pay attention to the trails of it, how it gets you to the goal. And so as an investment in all of our health, not everybody, a lot of people use Amazon, me included, but not everybody uses Amazon.
Me too.
Everybody is impacted. Too much. Yes.
Too much. I use it too much. Yeah.
But literally every American is impacted by something that HHS is over. Everybody, every day. So to think that they're using a fraction of the employees that a private business has already hired is actually a great way to think about it.
Yeah. I mean, just if you, the tiniest fraction in comparison. One of the other things that I worry about too is what kind of, because these systems are complicated, actually, right? Like bureaucracy is complicated. We all know this. One of the things that we all don't like about it is all the red tape and the rules and things like that. Of course, the flip side of it is those rules are put into place as a measure of quality control, right? To make sure that people can't take advantage of the system, that there are units of measurement to make sure that things are going the right way, to ensure that there's not corruption in the process. Like that's what all that red tape is for a lot of the time, even though it's frustrating. I can't remember where my thought was going with that.
Then I will interrupt you because the red tape is important, because one other thing that got cut was the Provider Relief Bureau, which was, and that just happened on April the 1st. We're recording on April the 4th. And it closed that whole agency. But that agency was actively working. Like the whole point of that agency was to recoup nearly $1 billion for the agency that healthcare organizations and providers misused from COVID-19 payments. So they recognized the fraud, they were rooting it out, and they were working on getting the dollars back. Right? It's one thing to recognize who did it. It's another thing to actually get the money back. So they were doing that, and in those just efforts to save money, getting some money back would be great on their little receipt tracker. And you just shut down that whole agency because they probably didn't pay attention to actually what it was doing. They just were Provider Relief Bureau, get rid of it, So it's really important to be thinking strategically about how we're changing or downsizing anything so we can get the maximum benefit.
Okay, so your talking made me remember where I was going with that whole red tape thing.
Okay.
Point being that this stuff is complicated because there are a lot of rules involved. When we massively get rid of a lot of people who know the rules for how this stuff gets done, then how does it get done? Who steps in and has to learn everything all over again, or just breaks a lot of laws and a lot of rules in the process of just trying to get things done. Like, I don't think that you can overstate the value of human knowledge and human wisdom when it comes to figuring out how to work through a system. Like, that experience, institutional knowledge is so incredibly valuable. I would say when I'm working with clients or patients, like, that's one of the number one skills that I actually bring to the table, is beyond just doing the regular old, you know, my job as an occupational therapist, trying to help them do the things that they want and need to do. I'm also helping them to navigate the system that they're in. I'm also giving them information about what their next stage of rehab is going to be like, the things that they need to expect there, how to get the best out of that next stage of rehab, how to advocate 100. For themselves. And that's not knowledge that anyone taught me in grad school or that I just showed up with. Like, this is hard-won knowledge that I've learned over almost 15 years of practice that I can pass on so that it can make other people's lives easier. And if you were to wipe out all of that type of knowledge, or a huge chunk of that type of knowledge, what happens? How do can the systems continue to function, or do they break down? And what are the consequences of those systems breaking down? Does it mean that healthcare bills don't get paid and rural hospitals close, which is already a big problem? Does it mean that you can't get your surgery completed that you need for your hip replacement, or for your back surgery, or for whatever it is? Like, is that what that means? And I don't think that we know all the answers to those questions yet, but they're questions that we should be asking, because one of the most wonderful things about America is that we have the right to ask those questions. And in fact, it's our patriotic duty as Americans to ask these questions, because everyone in the world doesn't get to do this. We get to hold our government accountable. And that is an incredible right that we have that not everyone else has in the world.
Yeah, we are a representative democracy, which means our representatives are supposed to be speaking our language and sharing our needs up the chain, so that things can get done. Do things get done? They're changing now, right? And so
things are getting done.
Things are getting done. I don't know if they're things that I like, but they're things that are getting done. And so I think it's like so important to know that, like, while it sometimes feels disconnected and that maybe you don't have a big voice, you as an individual do have a voice, especially if you collaborate with the people around you in your neighborhood, in your home, to amplify that voice up to your representatives. Because while they get a lot of mail and a lot of like correspondence, they should, and that's the point. And it's their job to sift through that and be like, listen, I had like 1,000 calls about what's happening with HHS, and I had 100 calls about what's happening with whatever else. Like, doesn't mean that whatever is not important, but clearly my constituents think that this is a really big deal. So let's like be real intentional about how we deal with this. And let's take a look at some of these opinions. That's how the thing works. And then they take those opinions up and they decide how they're going to work on that. And that's how change is made, right? And so you can't get to 1,000 people without having the first one. And so while it might feel like I don't know 1,000 people to call, you can be one of the thousands if you actually do call or send a letter or go to a town hall or make your voice heard about these things. Otherwise, they think you don't care. And then they're just going to do what's in their best interest. If they actually have the documentation to push that shows that like your constituents want this, and then if you reciprocate by not voting for them, if they don't do what you want them to do, that's how things change in America. That's how things change. So I think it's just really important that, like, it's the beginning of April. Most people have like a local election either just happened or coming up. And that impacts you very directly, your local elections, even though you don't maybe see them on the news as strongly as like a presidential election and what's happening in our federal government. But these agencies in your community are figuring out right now how to keep doing the work that they're doing without the money and the support that they've been getting from the federal government. So they got to make hard decisions, and you should be a part of that, right? And like, okay, if they got to cut something, let's let it not be this, and let's let it be this other thing, right? We agree. We're going to say that. So make sure you're voting in your local elections to make your voice heard, so that we're not just complaining, about things not happening the way we want them to.
Mm-hmm. Yeah. And I think it doesn't matter what side of the aisle you fall on or how you feel about the cuts one way or another, or how you feel about, anything that's going on one way or another. I think we have to be asking more questions about, like, okay, if you think this is great, government is too big, we have to cut these folks down, this is awesome, like, yeah, we're gonna break some eggs, but at the end of the day, we're gonna come out better for it. Okay, we still have to ask the question about which eggs are going to be broken. What is going to happen as a result of this process? Is there a plan for how we come out better on the other side of this? Mm-hmm. Because no matter what side of the aisle that we fall on, and really, like, I don't think health is not a political issue. This is a human issue. That's where I stand on this. Like, this isn't about politics. This is about
lives.
My mom and my dad and my neighbors and my kids and all of the people in my community and my families that I love. And that's what this kind of stuff is about. So if we're going to make changes, we have to really want to hold people accountable for giving us specific answers about what these changes are and exactly what the impacts are going to be. And I don't think that we should be satisfied with answers that just say, well, we're going to make it better. We're going to save you money, and we're going to save you money, and we're going to give you more. Because listen, that sounds awesome to everyone. You're going to do more for less. I'm down with that. No one is not down for that. Like, more services, less money. Yes, sign me up, please. But how are we going to make that happen? Where does the rubber really meet the road? Because details matter in where that collateral damage falls. And for me personally, like, I don't think anyone's health should be collateral damage.
No, totally. I mean, think about it like this. If your kid came to you and said, you know what? I'm going to do less homework, but I'm going to get better grades. Don't worry about it. I got it. And you were just like, you wouldn't just be like, that's okay. So I'm marking this right here.
Okay.
Ashley, hi and welcome. It's good, except for we're still recording a podcast. But will you come back in at 10 o'clock on the dot and we'll be ready for you? See you soon. Okay. I forgot what I was saying. Was I saying or you saying?
You were saying, and you were talking.
Oh, kids.
Yeah. Homework. Yeah.
So if your kid said that to you, are you going to just be like, sure, sounds like a plan. Go ahead. Or are you going to be like, I don't understand how that works. Explain that to me. Like, it's okay if we're going to do something different, but I need to have a plan about how that different thing is going to take place.
Yeah. Yeah. And maybe their plan is a really good one.
Could be.
But are you going to accept that on face value and
say,
no, absolutely not. You're not going to do that. You're going to want to know what the plan is first. Right. Yeah. Because, that's your job as their parent.
That's your job. That's literally your job.
That's your job. Yeah.
Well, I hope that I hope that people feel a little bit more knowledgeable, at least about the change, because so much change is happening so fast right now.
Yeah.
But at least about the changes that are happening and proposed to be happening around health and human services and our healthcare in America. And I'll be the first person to tell you healthcare in America is broken. But I need, plans and data and step-by-steps that we're going to do in order to make it improving, not just like a slash and burn. And then once we tear it down, then we'll try to rebuild it. Because while that might work for a really big legacy system like we have, it means that lives are collateral damage in the meantime. And that's just not okay. So make sure you're getting out to vote. And because only 40% of Americans actually vote in non-presidential elections. Only 60% of us vote in presidential elections, where other countries have it at 90%. So like your voice actually does really matter a lot because not all of us are going to vote. So please go do that and make sure you stay informed. And if you have questions, we're not experts on this topic per se, but we want to hear what you're concerned about because we can bring experts to the table so that we can talk more about it, whatever it is. So make sure you're putting that in the comments. You should liking and subscribing, share an episode with a friend, because all of that helps make sure that these conversations get heard by the people who need it.
Yeah, thank you so much for watching, listening, whatever. Thanks for
both.
Thanks for listening and watching Care Lab, and we'll see you next time right here. Bye, everyone.
Bye, everybody.
This is the Whole Care Network. Helping you tell your story one podcast at a time. Content presented in the following podcast is for information purposes only. Views and opinions expressed in this podcast are solely those of the host and guest and may not represent the views and opinions of the Whole Care Network. Always consult with your physician for any medical advice, and always consult with your attorney for any legal advice. And thank you for listening to the Whole Care Network.